Dr. Bobby is in house this morning to give us a little bit more in-depth conversation. Good morning.
Good morning.
Tell the viewers exactly what kind of meningitis Jesse has.
Sure, yep. So from what I've heard and read, it's what he's got is what's called streptococcal meningitis. So strep is a bacteria, and this particular type of strep is called pneumococcus. And it's not an unusual bug. It's a bug that a lot of people get, and a lot of people are carriers of it,
right.
And it kind of causes upper respiratory type infections. And from what I read in the newspaper, the reason that it caused a problem in Jesse is that he had a previous fracture of some sort from a car accident that basically created a little bit of an opening between his nose and sinuses and then the brain, which is just on the other side of that thin bone. And so what it does is normal bugs that are in the upper airway can track through that opening and get into the lining of the brain, which is called a meninges, and hence meningitis. So it was more, I think, of an anatomic issue with him, and not that it was a particularly bad bug that caused this problem.
So the type that he has is not necessarily contagious?
Correct. No more contagious than me having some strep infection and then passing it to you. So it's not the kind that spreads like wildfire, like some of the things that you hear about in college dorms and things like that.
Whenever someone hears meningitis, we tend to be like, what?
Right. Exactly. Because
Talk
there's not
about that
supposed
kind
to be,
that we do kind of.
Right. Yep. So any bacteria that gets to that point where it gets to the brain lining is a bad situation, because there's not supposed to be any sort of organisms, viral or bacterial, in the brain lining. So so any bacteria that gets up there is bad. Now, some bacteria get up there more than others, and those are the ones that people get vaccinated for. And so of all the common bacterial meningitis causes, they're vaccinations for all of them, and they all work reasonably well, and some work great. So that's the key, is that it can be prevented by vaccination. Once it happens, it's a bad situation. It needs immediate attention to drain fluid off if the pressure is building up, to put kids on or put anybody on antibiotic to start to kill the bacteria.
And how young are kids now getting this vaccination?
You can get them even in elementary school.
Oh,
I think our kids have gotten it, actually. They're in 6th grade, yeah.
And I know a lot of the college kids are encouraged.
Yeah, definitely, yeah. They've brought in the recommendations, I think, last year or the year before, that it's not just college kids, but even middle school and high school kids. Just anybody that's in close quarters, that's sharing locker rooms, things like that, where bacteria easily spread. But, the key is the simple stuff: hand washing, hand sanitizer, just common sense sort of things.
So keep all that going. I think we actually talked to you about that when they had those new recommendations
exactly,
come out a couple years ago.
We sure did.
All right, Dr. Bobby, thank you so much.
My pleasure.